And today we're going to explore the different types of grief you may have heard the definition of, or it may be new to you, but normal grief. This is a typical emotional response to loss, including sadness, anger, and acceptance. But an example of normal grief is a person feels sadness after a death of a loved one, but gradually adjusts to life without them. Anticipatory grief, you're anticipating the grief. So grief is experienced before the loss. My mom has Alzheimer's dementia. I am experiencing some anticipatory grief as she continues to lose different abilities in who she was or who I perceived her to be as a mother. That's an example of that, but it's anticipating that, just the progression of the disease. Then there's complicated grief. This is intense, prolonged grief that interferes with daily functioning, lasting for more than months or even years. But an example of complicated grief is a caregiver struggling with persistent, debilitating sadness over years of their loved ones being gone, unable to move forward. Many times we lose individuals who have been in our lives for most of our lives. It can be very hard to kind of cope with and kind of move through, and that's complicated grief. We also have disenfranchised grief. This is grief that is not publicly acknowledged or validated, often because the relationship of the loss is not recognized by society. An example of this can be a loss of a friend or a cancer patient that feels unsupported in their grief because others only acknowledge family members' loss. Then we have collective grief. This is shared grief experienced by a group following a significant loss or tragedy. So this is like a community grieving the death of a local leader or a president or a politician or someone that was really significant in the community, but it's really not grieving alone. You're grieving in a group. So it's a group of people who really feel this grief and really understand. So you definitely have community and connection there. And then we have ambiguous grief. This is a grief experience when a loved one is physically present, but psychologically absent. And this can also be used an example, the one I use with my mom who has Alzheimer's dementia. She's physically here, but mentally she's not the same. And this can be hard for caregivers and even for the patients who are also grieving. So there are various types of grief. And I think when we talk about grief, it's important to put it into context as to what type of grief is this person experiencing? What type of grief am I experiencing? And I would love for you to take a moment to just think about what type of grief are you experiencing? How is it showing up for you in your journey now? Or how is it showing up for someone else?